Hi, I'm Dr. Shelly Singh. I'm Senior Consultant Obstetrics and Gynaecology at Delhi, Rosewalk Healthcare and Rainbow Hospital, New Delhi. So it's Polycystic Ovarian Syndrome Awareness Month. And what is Polycystic Ovarian Syndrome? It is a hormonal problem, the reasons for which are really not known. It could be genetic in nature along with lifestyle problems which could lead to this problem. Polycystic ovarian syndrome has also been called the metabolic reproductive syndrome now because it affects women in the reproductive age group. It's very commonly seen these days, and about 10% of the girls who come to our OPDs do have polycystic ovarian disease. It's often seen in teenaged girls as well, and in about 7 to 10% of these girls, it may have been unnoticed. One of the most common causes of infertility as well, but it is very easy to treat if it is diagnosed. So first of all, let me just run you through what are the hormonal changes which affect these girls. We all know that there are some male hormones which are present in all women, but for some reason, because of the hormonal imbalance, there will be more of the male hormones in these girls, which results in some problems like there could be excessive weight gain, there could be acne, there could be hair growth at unnatural places, for example, on the chin or the upper lip, or even on the chest. Apart from that, there can also be problems of infertility because ovulation does not happen, and instead the follicles build up fluid and they form tiny polycystic patterns which is seen even on the ultrasound. Now, infertility is not the only reason why girls come and visit us. It could be for acne, it could be for this hirsutism, it could be for the weight gain. It could also be later on due to problems like type 2 diabetes mellitus. It could cause heart disease as well, hypercholesterolemia. It also causes some problems like high blood pressure, sleep apnea syndrome, which means that there is a difficulty and problems when there is sleep. And apart from that, there could also be depression, and last but not the least, something as ominous as endometrial cancer. However, do not lose heart. How do we diagnose this? It's easy to diagnose depending upon a history. The doctor will take your history. Examination will examine you for all the signs that I have spoken to you about. And apart from that, we'll order some hormonal tests. These hormonal tests are, a wide plethora of tests which have to be done. And along with this, an ultrasound also has to be done. 2 of the 3 things are required to label it as polycystic ovarian syndrome. 1, there could be some problems of increased androgens or male hormones. For instance, you would have problems like acne, hirsutism, male pattern of baldness, and all the other features of increased male hormones that we have spoken about. Or along with this, there could be problems which are seen even on your hormonal pattern that may show increased androgens and a hormonal imbalance. Second, what is important is an ultrasound which may show features of polycystic ovarian syndrome, which means both the ovaries, or these days even we say that one ovary may be bulky and may be dotted with small little follicles which are actually small cysts which form since the girl has not ovulated. The third thing is that there can be menstrual problems. Menstrual problems could be prolonged periods. It could be periods which are extremely heavy. It could be sometimes shortened cycles, decreased flow as well. And there are numerous kind of patterns of abnormal menstrual flow that can be present. So one of these 3 things is enough to rather two of these things is enough to label a polycystic ovarian syndrome. Once diagnosed, we need to treat this. Now, how do we treat this? Treatment is also quite easy. Since it's a lifestyle problem, the first thing that is required is lifestyle modification, which means diet. It's very important to cut out on that junk food. It's very important to have foods which have a low glycemic index. You can even take a nutritionist support to help in this diet. You would be asked to have small, frequent meals, and portion size must be small. Secondly, we ask you always to have an active lifestyle. Make sure that you're exercising at least 5 to 6 times in a week, and make sure that this exercise is approximately for 45 minutes to 1 hour. And the main aim should be weight loss. The third thing is, of course, weight loss. Even if you lose approximately 5% of your current body weight, you will be able to correct a large part of your problem. And always remember that girls who have polycystic ovarian syndrome are not necessarily fat. It is not necessarily associated with obesity. In a few percent of patients, we are also finding that there is polycystic ovaries on different modalities of investigation, even if they are lean and thin. So the second important thing that I have spoken to you is a healthy lifestyle, which is of course very important that you do have some form of exercise, diet and weight control. Even if you are thin and lean, keep on with that exercising so that you are able to correct some of the insulin resistance which is associated with this disease. And if there is infertility, how do we manage it? It's very easy to manage. A, with lifestyle modification, and 2, with the help of some medicines which help in ovulation. And depending upon what the goal of management is going to be, there are different treatments and different medicines which are available. Whether you want to actually treat the acne, or whether you want to treat the hirsutism or the hair growth, or whether you just want to regularize your periods, whether the goal is infertility, or whether you actually just want to have a healthy lifestyle. So it is important that you take this in your own hand, seek support whenever you have problems like this, and make sure that you visit a doctor for something which is so easily treatable. Often we will also take the help of a dermatologist or the skin specialist. We would take the help of sometimes an endocrinologist as well, if required, that is. And along with this, a nutritionist and a wellness specialist also helps in the same. So a multidisciplinary approach is always very helpful where it is difficult, or where it is a little recalcitrant kind of a polycystic ovarian syndrome. But don't lose heart, don't lose hope. It is a very easily treatable condition. Stay healthy, stay happy, and know that there is something called polycystic ovarian syndrome.